I'm David Vawdrey. I'm the Chief Data Informatics Officer at Geisinger, which is an integrated health system in central Pennsylvania and New Jersey. We're talking today about healthcare transformation, and particularly how health information technology has changed the way that we as consumers consume healthcare, how we take care of patients, and how we try to keep our population healthy. Yeah, Geisinger is unique in a couple of ways. One, compared to a lot of healthcare systems that are well known in the country, a lot of the big academic health centers, they tend to still be focused primarily on a model of fee-for-service, meaning the more work that is done, the more they get paid. The more heart surgery we do, they want their hospitals to be full of patients. And you think of patients as customers. It's just like any industry. At Geisinger, we're much farther down the road of pivoting to what's called value-based care. Instead of volume, we're looking for value. We want to do the right thing for people, which most of the time means keeping them out of the hospital, keeping people healthy, keeping people out of the emergency room, avoiding unnecessary utilization. And the model of care that Geisinger is really pushing toward is enabled by the fact that they have not only the hospital and about 250 clinics, actually there's several hospitals, more than a dozen, 250 clinics, a lot of other types of services. But in addition to that, they are a payer. They have a health plan that covers about 575,000 lives. And the intersection between those two things, it's not 100%. Not everyone that has health insurance through Geisinger's health plan seeks care at Geisinger's healthcare facilities. And similarly, not every patient that is seen at our hospital has Geisinger health insurance, of course. But where there is that intersection, it's kind of a magic synergy, meaning that we want to, again, keep our patients healthier and out of the hospital. When the financial model is aligned in that regard, it allows us to really invest in creative new ways of keeping the population healthy. Things like a very exciting program that a lot of people around the country are talking about, which we call our Fresh Food Pharmacy. Pharmacy spelled F-A-R-M. The idea behind this is food as medicine. So if you take a population, for instance, and we have some areas in our geography that we cover that are considered to be food deserts, places where it's difficult to obtain fresh fruits and vegetables. And then if you combine that, if you overlay that with a population of people who are diabetic, have type 2 diabetes, they may not be eating nutritiously, and so on and so forth. When we try to manage that kind of population, keep them healthy using traditional, medicines, primarily drugs, we can have some efficacy. But what we found in this population that is taking advantage of our fresh food pharmacy, what the program basically is, we have actually 3 locations now. The first fresh food pharmacy opened in 2016. And the idea is let's prescribe food as medicine, to those patients who are food insecure, which generally means they're not eating a healthy diet. Let's send them to the fresh food pharmacy. They receive meals. They receive It's ultimately, it looks a lot like a grocery store. It has, in addition to fresh fruits and vegetables, lean meats, and healthy types of foods, it has a strong education component. So we teach people to cook. We teach people basic nutrition. And the results in that population, I can tell, maybe one quick story of one of our patients. His name's Tom. He's a diabetic man who had with diabetes who had in prior years something like $200,000 of medical bills. He'd unfortunately had a toe amputated and was just really living in a difficult situation with uncontrolled type 2 diabetes. Once he started in this program, and the Fresh Food Pharmacy, the patients or the members of our health plan that receive food through this program, it's for them, it's for their families. Sounds like an expensive program, but believe it or not, it's much more efficient for us to provide those types of services and keep people like Tom out of the hospital. In the course of 6 months, Tom lost close to 50 pounds. He saw his hemoglobin A1C, which is a blood test that sort of assesses the severity of your diabetes, dropped from a level that was like 13 down to a normal range of 6 or 7. So that was Tom's really remarkable story, and it's happening with dozens and hundreds of other patients like him. So that kind of model doesn't exist, or won't be likely to exist in places that are still focused on, the volume, the fee-for-service type of idea. So that's one really big differentiator for Geisinger. Yeah, the financial model isn't aligned to support that type of care in most parts of the country and most organizations. Yeah, so even a program like our Food as Medicine, our Fresh Food Pharmacy, requires a lot of technology. There are bricks and mortar sorts of operations, but we need to understand who needs those services, who will best avail of those services, how we can track their outcomes and so forth, and how to help them live their healthiest lives. So there's a big data component to that. And we could point to that program or many others that are very, very information technology or data heavy. Geisinger is a leader nationally in what's called informatics, or the idea of providing information to people to improve outcomes. We've had the same electronic health record system for 2.5 decades at Geisinger. Just to put that into context a little bit, I remember as a student years ago, it was during the George W. Bush administration, and I was happy because I was studying informatics. My family didn't know what that was. It was hard to try to explain what I was, embarking on in terms of career path. And the president stood up in the State of the Union address and said, "Within 10 years, we want every person in this country to have an electronic health record." It was a pretty radical idea at the time. They'd been around, but the penetration or the adoption of electronic health records was single digits at that time. Now, to be sure, not much happened for the next 5 or so years, but when the American Reinvestment and Recovery Act was signed into law under the Obama administration, a big component of that was a program to promote what was called the meaningful use of electronic health records. And that program provided both financial incentives and also a penalty for people that didn't adopt electronic health records over time. And as a result of that program, we saw adoption of health information technology and electronic medical records specifically in hospitals go from, like I said, single digits, maybe 10%, to high 90s, which is pretty remarkable to think of that kind of transformation that took place in the country. And it happened not just in hospitals, but the numbers are very similar when you look at outpatient care, clinic practices and so forth. And so a lot of people these days, that's still sort of fresh. That large technology adoption is still fresh, and for many practitioners or many providers, nurses, physicians, and others, it's still a point of a lot of challenge. Using technology hasn't been easy. Some of the technologies don't work the way they should, the way they need to. We need to focus on usability and so forth, improving the workflows. But we're really getting to a point where we can transform healthcare using data that we didn't have, 10 or 15 years ago. Now, like I said, Geisinger was an early adopter in this area, so we've got decades, literally, of information that we can mine and apply new technologies like artificial intelligence, machine learning algorithms, to create predictive models. And I mentioned a moment ago, who would most benefit from a program like our fresh food pharmacy? Who can we send a nurse or an advanced practitioner through a program we call Geisinger at Home? Who needs those types of services? The hospital at home. How can we send people into our community and take care of them at home in a way that will prevent them from needing an expensive hospitalization? So that's some of the, some of the potential for me of technology that we can unlock once you have the data and once you have algorithms and so forth to train and use in that context. It's a great question. I think the advantages are clear. Better and safer healthcare, more affordable healthcare, more convenient healthcare, lower risks and fewer complications. That's the promise. Now, sometimes we have what we call unintended effects, and there are instances, to be sure, where the misapplication or the clumsiness of the technology has resulted in increased risk and even inpatient harm in some cases. But another of the big risks that's very important, I think, to me and to many people around the country is the risk of privacy. CBS News reported that you can buy on the black market, the dark web of the internet. You can buy a Social Security number for $1. Maybe a Social Security number sells for $1. Someone's medical record might be 10 or 100 or even 1,000 times more valuable. And so this information, it's some of the most sensitive information we can imagine about ourselves. We don't want that obviously falling into the wrong hands, and we want to be in control of how that information is used. We want that to be done in a responsible, ethical, transparent fashion. So that's another area where I think Geisinger has been a real leader. This idea of empowering patients, making the information transparent to them. We were one of the first healthcare systems in the country to adopt a program that's called Open Notes. The idea behind this is if you're my physician and you write a note about me after an office visit, I get to see that, and I get to see it not only in a timely way, but in a way that I can access it on my phone, I can get it from my computer at home. We're trying to make this much, much easier. Historically, you might be charged 50 to 75 cents a page, and you'd have to go through a lengthy process to go through the hospital's medical records department. These days, we're making that available instantly. And in fact, we're doing that while patients are still sitting in the hospital. In the case of a hospitalized patient or their family, they can securely access on an iPad or a tablet computer the information that was previously quite opaque. When you think about being a patient in a hospital, it can really be one of the most disempowering, isolating, frightening experiences. And one of the big challenges there is the lack of awareness of what's going on, or even who's taking care of you. So we had an idea a few years ago to build on that open note concept. Let's give patients an iPad, we thought, while they're in the hospital. Let's show them with names and roles and faces, photographs, who's taking care of me, what are they doing, what tests are being ordered, what medications am I being given, and let's make the whole thing a transparent process. A lot of people were nervous about that. We had a lot of anxiety on the part of certain members of the medical staff. Is this going to make my life more difficult? Is this going to cause my patients unnecessary anxiety? Is this going to increase the number of questions that are asked? And the truth is, it's been almost all positive. People feel entitled to that information, as they should, in my opinion, and they feel empowered once they have access to it. And that, I think, is really transformational, this idea of transparency and trust, being part of the team, Along with it being, again, in my opinion, the right thing to do, there's becoming more and more evidence available that shows that outcomes are better. In other words, a more informed, a more engaged patient has better outcomes clinically and psychologically. I think that's just it. More transparency, more trust, more communication. It's just like any relationship. But if we think back to the way that medicine was practiced for decades, it was a very personal type of environment, type of a culture. We've lost some of that, and I think technology is partly the reason for that. If you go to your physician's office today, she may spend much of the visit with her head in the computer screen or hands on a keyboard. And I think none of us believe that that's the right way to practice medicine. It certainly doesn't feel good from a patient's point of view. I know there's a lot of important things she's doing on the computer, and I appreciate the value of that. But it really can get in the way of the patient-provider interaction. And so we're looking at new ways using technologies like voice to get hands off keyboards and eyes off computer screens and restore, that almost a sacred relationship, the sacred trust that exists in the patient-provider interaction. Well, it's been said that the best technology is invisible, to the point that, to the extent that if I don't know it's there and it's helping me, that's a great technology. Let me give a quick example. A lot of times I think our providers, our physicians, nurses, and others feel like we're asking them to do more and more with technology. And again, many of them, I think rightfully feel like that's getting in the way of the job that they're really trying to do, doctoring and providing care for patients. One thing that was created at Geisinger a few years ago, specifically in the domain of radiology, uses an advanced machine learning model to identify head CT scans. What we're looking for here is what's known as an intracranial hemorrhage, bleeding in your brain. It's rare when someone goes into an outpatient setting and a CT scan is ordered. Most of those come back normal, but a small number of them might have, this evidence of something more serious going on. So when you think about the way the radiologist does his or her job, they're basically working off a list, and historically it was a first in, first out list. They might have 40 x-rays or head CTs or other types of things to review, and they'd take them in the order in which they came. With the model that was created at Geisinger, by looking at years, decades really, of historical head CT scans that were classified by radiologists as normal or abnormal, you can train what's called a machine learning model. You train a model that says, hey, this one looks suspicious. The model may not know exactly why. It's looking at an image. It's a lot like the same technology. It's a lot like the technology that's being used to create self-driving vehicles and things of that nature, looking for patterns using cameras or other types of sensors. So we can look for those patterns, and we can identify using this algorithm the CT scans that look like they're higher risk. And what we do is insert them into the queue at the top. Basically take the high-risk things, put them at the top. The radiologist, what I mean by invisible technology is the radiologist doesn't even know it's running. We've educated them and so forth, but in terms of the impact on their workflow, they're doing what they always did. They're reading films. But what we showed is a greater than 95% reduction in the time it took to diagnose a serious event, a head bleed, an intracranial hemorrhage. So that type of technology, I think can really be transformational, and there's a lot of different applications, not just in the imaging, medical imaging world, but in other areas as well. Yeah, if you ask me about what healthcare is going to look like in the future, I think it's going to be very different from today, number one. I think the idea of being in the hospital for extended periods of time will probably, change to a large extent as care kind of gets pushed down to other settings. And maybe just on that point, maybe it's worth telling you a little bit more about our Geisinger at Home program, the whole idea around population health. There are estimates, there's good data as a matter of fact, that upwards of 4 in 10 people in this country suffer from one or more chronic diseases. And often when you have one chronic disease, we're talking about things like heart failure or diabetes, hypertension, high blood pressure. When you have one of those conditions, you often have it for the rest of your life, and so it becomes a management issue. And our goal as a society and as a healthcare system is to delay the progression of that disease and in some cases try to reverse it, help people live and manage with chronic disease. It's a very big challenge and probably a $2 trillion problem for the country. So if you can move the needle only a small amount on that, you're saving literally billions of dollars. What's Geisinger doing in this area? I mentioned our Geisinger at Home program. We're sending nurses and advanced practitioners into the home. The hospital at home kind of a model is one piece of that. But another really important concept is, we can only do that for the sickest of the sick. And it becomes very quickly a scalability problem. We have 300,000 plus members of our health plan or patients that are part of our network that live with chronic diseases. How do we identify who needs what services when? Whether it's an intensive home visit by a nurse, maybe it's a phone call, maybe it's a pharmacist double-checking the medication list, maybe it's a care manager or a care coordinator identifying that the patient hasn't had a flu shot this year. And by getting that flu shot, they can literally reduce their risk of dying. These are the types of things that we're really exploring through a program we're calling a Chronic Disease Management Command Center, thinking about how we can empower a small number of people to care for a large number of chronically ill patients. Home monitoring, artificial intelligence algorithms that predict deterioration, patients reporting back symptoms from their homes, perhaps using technologies like Alexa or mobile apps on their phone. You can envision a healthcare of the future that is very fundamentally different from the way we think about treating, highly acute patients in the hospital or even in the clinic setting. I think healthcare of the future is delivered in the home setting. So the origin story of Geisinger, when I learned it, I was immediately taken in. Abigail Geisinger was a woman of some means. She had married, I believe, her second husband a little bit later in life, and he had some means, but he passed away at a relatively young age, leaving her a widow. And she was a widow for 25 plus years. This is around the turn of the century, and so at that time in Danville, Pennsylvania, there was no hospital, and access to the closest medical care of that type was probably, 30 minutes away or more. Now, Abigail Geisinger had one of the first automobiles, and she used to, as I understand it, loan out the car. She had a driver, and she would loan out the car when someone needed to go to the hospital. So after doing that, she recognized the need and decided that in honor of her late husband, she would open a hospital. She was in her 80s at this. She was 85 years old, the turn of the century. Do you think how unique that was? And so she said, build a hospital, make it right, make it the best. Make my hospital right, she said. And she hired a man by the name of Harold Foss, Dr. Harold Foss, which was also unusual. She hired a physician. He'd come from the Mayo Clinic. and she hired him to be the first physician-in-chief, if you will, of the Geisinger Memorial Hospital. That was 1911, I believe, the early part of this century. And so we've got a 100-year history of that culture of innovation where our physicians are employed by the health system, where we have an insurance arm, as I mentioned, that allows the synergy of payer and provider. We have a precision medicine program that is, quite literally the envy of my academic colleagues around the country. We have 250,000 plus patients who've consented to participate in our what's called MyCode, where their DNA is sequenced and important findings are delivered back to the patients and help improve their care. Doing things like that on a scale that few, if any, in the country are doing. So the model of care around Geisinger involves a lot of technology, it involves a lot of very talented clinicians and embeds research as a real learning health system. But fundamentally, we believe it goes right back to Abigail Geisinger's views about caring. We take care of people. That's what the organization is about, and that's what I find inspiring to work there. We care for our patients, we care for the members of our health plan, we care for each other, the members of our Geisinger families, 40,000 strong. Well, to paraphrase the comments of President Obama, Geisinger is a model for transformation of healthcare for this country. And I think what he meant by that was we're already down the road of value-based payment beyond what most places in the country are doing. And so healthcare is changing whether we want it to or not. It's going at sometimes a quicker or a slower pace. But it doesn't matter if you're Democrat, Republican, or otherwise. Everybody recognizes that the healthcare spending challenge is real. 40 years ago, the percentage of the GDP, the gross domestic product, that was allocated to healthcare spending was around 9%. These days, it's almost double that. And so when you think about, the ratio of healthcare spending in this country as a percentage of the GDP, it's clear that that's not sustainable if that number continues to grow. The second thing to point out is most other wealthy nations in Western Europe or Canada, Australia, Japan, they spend from 40 to 50% the amount that we do. In other words, we spend 2 to 2.5 times more money on healthcare in this country than do other nations. And you might argue that that's a good thing if our outcomes were far superior to theirs, but the reality is they're not. In fact, in many areas, they're worse. Life expectancy is lower than many other nations. Infant and maternal mortality rates are less favorable, sadly. And so when we think about, the potential for healthcare transformation, it has to come obviously from a policy perspective. It also has to come from a sort of a population health, people being willing to take responsibility for their care, to be sure. But when it comes to an organization like Geisinger, how can we be the beacon for others to follow? And we do that through programs that focus on keeping our population healthier. We do that, frankly, in an area that is not easy to accomplish that goal. Underserved populations, difficult to reach rural areas, older, sicker patients, members of our community. But we're committed to doing it. We're committed to doing the right thing and being an example for the rest of the country of how to do that. And to me, it boils down fundamentally to the value equation. And we define value in healthcare oftentimes as quality, meaning the outcomes that are attained, the level of complications, and things of that nature, the experience, quite frankly, that we're judged on, as we should be. All of those things divided by the cost of care, and you could attribute the cost, as I just said, as a fraction of the GDP, or how much is being spent in healthcare premiums, or what's going out the door from Medicare or Medicaid services, but also the human cost, the cost to the patient, his or her family member, caregivers, and others, both financial as well as emotional. Our focus, obviously, is to reduce that cost and increase the quality, so that overall the value, improves. I think the model that Geisinger has to share with the rest of the country is focused on caring. It's focused on value, and focused on doing the right thing for our patients, our members, our communities. And by doing that, as I said, we become an example to the country and to the world.